illnesses, diseases in the prostate can actually affect urination. Disease in the prostate is what causes problem, not the prostate itself. So you don't actually say my father has prostate because every man has a prostate.
As a be, beautiful people, it is as it be on Federal Square News. I am very lucky. For in Head Talks today, I'm with one of the best doctors in Enugu State. And I'm talking about no other person than Ichie, Dr. Bon Eze, Chief Medical Director, St. Sylvester Multi-Specialist Urology Hospital, Chief Consultant Urologist and Head of Urologist Division, Parkland, Enugu. Doc, you're welcome on board.
Thank you for having me.
Thank you, Doc. All right, today we'll be talking about prostate. Doc, please, can you tell our people what is prostate?
Thank you. One of the myths people have is believing that prostate is an illness. Prostate is not an illness. It's just an organ, a walnut-shaped organ located just beneath the bladder of every man. Even the one that is still in the womb has a prostate as an organ. And what role does it play? It plays a very important part in contributing to the seminal fluid. That is the fluid in which spermatozoa is suspended in. That's what it does. But because of the close relationship between the prostate and the urethra, the pipe through which urine moves from the bladder to the exterior, because of that relationship, illnesses, diseases in the prostate can actually affect urination. Disease in the prostate is what causes problem, not the prostate itself. So you don't actually say my father has prostate because every man has a prostate. But it's now when there are issues in the prostate, that is what the problem is.
Wow. Thank you, Doc. Doc, what is the difference between prostate enlargement and prostate cancer?
Okay. Every man has a prostate, as I said.
Yes, Doc.
And then there are some conditions that can occur in the prostate that can lead to symptoms that might present in a lot of ways. The worst being not being able to pass urine. And then these problems could be either an infection in the prostate, prostatitis. It will lead to some form of enlargement that can affect the way someone urinates. But as one ages, the prostate tends to increase in size. So increase in size of the prostate occurs with age. Is a normal aging process. Then if that increase in size can be divided broadly into two, like when I see a man and say, oh, the prostate is enlarged, an increase in size of the prostate. But this enlargement could be of two types. The one that has cancerous cells in it, that's what we call prostate cancer. And the one that doesn't have cancer, we call benign prostatic enlargement. So both cancer and non-cancerous enlargement occurs. What differentiates them is whether there is cancer in the prostate or not. If we are able to prove from history, physical examination, and some tests, and the pathologist, when we send him a specimen of the prostate, looks at it and say, oh, I can see cancerous cells in it, it becomes prostate cancer. If on the other way around, we take history, we examine, and the pathologist examines the prostate and say, oh, there is no prostate cancer cells there, it becomes a benign prostatic enlargement. So we have prostate enlargement, which can either be a cancerous enlargement, which we call prostate cancer, or a non-cancerous enlargement, which we call benign prostatic enlargement.
Beautiful people, you can see already I am being schooled and I know you are learning. Don't forget it is on Freedom Square News. And it is good to let you know that we will have follow-ups. Okay, we may not exhaust all we have to know today. So keep online, and don't forget your comments, your questions, your suggestions are very, very necessary. And if you do well to share, who knows, you may just be educating someone to save a soul. And don't forget, I'm with Ichie Dr. Bon Eze, Chief Medical Director, St. Sylvester Multi-Specialist Urology Hospital, and also Chief Consultant Urologist and Head of Urologist Division, Parkland, Enugu. All right, Doc, this prostate, can it be restored to normal size or corrected medically?
Thank you. It is important to note that the treatment we give for an enlarged cancerous prostate cancer is different from the treatment we give for a benign prostate enlargement. There are two different treatments. And then there is what guides treatment that we recommend for patients that have prostate enlargement. But give and take, we don't really have something that will say, okay, let us shrink it, as I say. It's just a normal process of aging. What we now do, we depend on one, the stage at which the patient is presenting. Two, the severity of the symptoms that the patient is presenting with. Not everybody that has an enlarged prostate demands or requires treatment. Depending on the severity of the symptom, you can say, okay, oh, your prostate is enlarged, we have screen doesn't have cancer, we just follow you up and track how the symptom progresses. There are some that medications will improve their symptoms, okay, and make them to be okay. For instance, if a man has an enlarged prostate that's really beginning to affect the functions of his kidneys, you don't tell him, go, let's write you drugs. Because if the kidney packs up, it's a disaster. So there are still other conditions we see, and we'll be able to say, this is what we do for you. So prostate treatment is not like a one thing fits all type of thing. There should be proper evaluation. And the most difficult thing facing a doctor seeing a patient who is having issues with urination is, first of all, to prove that those issues are from diseases of the prostate. That will be the first thing. Not every difficulty or problem with urination in a man is due to the prostate enlargement. So the first thing is to, okay, cone down the problem to the prostate to start with. When you already do that, you now put a lot of things into consideration. What you might do for Mr. A that has one problem might not be the same thing you might do for Mr. B that has the same problem. A lot of issues we have to be put into consideration. That is where proper evaluation of the patient, because patient should be evaluated properly. Then options that should work should be presented to the okay, because of so this thing, I think you benefit either from this or from that. Is until we get to that point, patient will now be able to say, okay, I will choose this because it has disadvantages, or I will not choose this because I can't afford it. You know what I'm trying to say? Yes, so I can't just see a patient, or nobody sees the patient and say, okay, this is what I will do for the patient that is going to work. There are a lot of variables that must be put into consideration before choosing what should be done for the patient. But what should guide what should be done is the particular or peculiar problem the patient has, not the doctor, not the patient chooses. Is the illness that chooses solution. Because until you clearly define the problem, whatever solution we are offering should be a solution that should be tailored towards all the problem the patient has, not a pre-prepared solution by the doctor or the predetermined solution by the patient presenting and saying, this is what I want. It won't work that way.
All right, beautiful people, you can see, I know you are enjoying it already. Please remember, your questions is very necessary so that it can shape our next episode. All right, Doc, you made mention that you can't just determine it by looking at someone.
Exactly.
So that will bring me to an incident that somebody didn't urinate from, let's say, 1 a.m. in the midnight till morning. So around 7, 8, they went to the hospital and the doctor looked at him and put one urinary tube. Don't know what you call it.
Call it urethral catheter.
Okay,
Urethral catheter. Don't put it off your tongue. It's not in the area.
Right.
Just call it a tube. Put a tube.
All right, but is that tube really the first thing to do to help such a patient?
Now, when a patient cannot pass urine, because I didn't see the patient, there are some details I don't have, but I should be able to give a balanced response. If I have a patient who is not passing urine, there are two possibilities. One might be that the kidneys are not producing urine. In that case, the bladder will be empty. The patient have not passed urine, but does not have the urge to urinate. Like he's not feeling as if he's pressed to go and urinate. So when I say patient like that, I will check first. Does the patient have urine in the bladder and can't pass it out? Has produced urine is stored in the bladder normally and has been trying to urinate but is unable to pass urine. What you call it is urinary retention, which could either be acute or chronic. Any form of urinary retention, the first aid treatment to it is pass a urethral catheter, pass that tube you talked about. That will relieve the patient of the immediate problem. Then the next question will now be, why was this patient not able to pass urine? It might not really end at that. At some point, you might try to pass that tube and it doesn't pass through the urethra, like they couldn't pass through the man's manhood. You have to now do a surgery and pass the urine from the lower part of the abdomen, the belly, into the bladder to drain the urine first. So that should be the first thing to do. But that shouldn't solve the problem. But what you now see some people, we pass the tube, the patient urinates, you remove the tube and say, go home, we are okay. It doesn't get okay that way. You must get to the root of why was it that this patient could not urinate. So passage of the catheter, first thing. Subsequently, history, examination, investigations to determine why the patient couldn't urinate. But see a situation where, okay, they just pass the pipe, after a while, remove the pipe and say, yeah, okay. If you do so, the likely thing is that the whole process will repeat again. Patient will go into another urinary retention. And the challenge will be a patient that cannot pass urine, if it's due to a prostate problem, whether it's benign or whether it's cancerous, is not the issue. Repeated passage of that pipe through the urethra, just like a road, can damage that tract, and that will create a more serious problem.
All right, remember, we are Freedom Square News, and I'm with Ichie Dr. Bon Eze, Chief Medical Director, St. Sylvester Multi-Specialist Urology Hospital, and also Chief Consultant Urologist and Head of Urologist Division, Parkland, Enugu. All right, is there any age bracket that someone will begin to experience this?
Like I said, is a process that comes with aging.
Okay.
Is that a process related to aging? So if one are from 40 years and above, it's possible you can start experiencing some prostate health challenges. But just know that people don't grow old at the same rate. There is a difference between chronological age, like what is your date of birth, and physiologic age. At what age are you growing old? But as from 40, prostate problems, health challenges start becoming common. And then at that point, most of such problems are the non-cancerous type. Cancers occur later as people age further, from 60, 65, 70 years.
All right, people, remember I said we may not exhaust all we want to exhaust. Even in a year, we can't. So, we'll, by God's grace, beg doctor that we repeat this again and again. Finally, on this episode, Doc, please, can you just give us some of the symptoms?
When we come to the issue of symptoms, it's possible to have a prostate issue without symptoms. especially when we are talking about cancer. You could have prostate cancer when the cancer is still in the early stages where we can actually cure you. It might not present with symptoms. That's where screening plays a role as you age. Walk into any hospital, tell the doctor you want to check your prostate health, and then take it from there.
Okay.
It can actually be asymptomatic. You don't have any problem. I've seen a patient just because somebody recommended do a PSA, it was more than 100. And when we are saying with the biopsy, his logic came out is something like cancer. He said, I don't have any symptom. Yes, such people without symptoms, it's possible to achieve cure, even though it's a cancerous situation. But if it's just an enlargement that is benign, later as the illness progresses, you will start having what we call lower urinary tract symptoms. The problem is many men think that problem urination is a normal process of age. You don't need to do anything. I'm no longer a kid. But if you are a man and you go to urinate, and at that point you get there, you need to wait for some time before the flow starts. You might have some prostate issue. If as this flow starts, you realize that the strength of your stream is no longer as strong as it used to be. It can't move as far as it's supposed to be. It's now running like where the tap is running, where you put your bucket, you need to go to the market and come back before you look to know whether it's filled up or not. Then there is a problem. If when the stream starts, you need to strain, apply pressure to push out the urine, it could be a problem. If after a while the urine will stop and restart again, it's still a problem. If at the end of urination it doesn't stop abruptly, it starts dropping or dribbling, is also a problem. If you finish urinating, it wouldn't be up to 1 or 2 hours. You are still having the ulcer, is also a problem. If you finish urinating also and you are still feeling as if there is still some urine left in your bladder, is also a problem. If you need to wake up more than once or twice or even up to 3 times at night to urinate, is a problem. If you can't hold urine, let's say as we are on this panel now talking, I have to dash out. I can't say, let me give myself 10 or 15 minutes so that you can round this off and I can go and urinate. The urge comes, it's so impulsive, you just have to go or you wee on yourself, is also a problem. If you have any of these problems, it becomes very important that you see a doctor, preferably a urologist. But as I said, as they are aging, it's important to take a look because you might just catch a problem when it's still in the budding stage and be able to take care of it entirely.
All right, people, thank you for staying there with us. Remember, it is as it be on Freedom Square News. And don't forget, here with me is Chief Dr. Bon Eze, Chief Medical Director, St. Sylvester Multi-Specialist Urologist Hospital, and also Chief Consultant Urologist and Head of Urologist Division, Parkland, Enugu. I know you may want to, Doc, please, can you drop your contact in case somebody wants to talk to you over the phone?
Thank you for having me. It's been an interesting episode. Naturally, I'm a teacher. I lecture also. I teach surgery in a suit.
Thank you very much.
So, teaching is something I actually enjoy, and I won't pass on any opportunity to educate people. As when the Bible says, "My people perish because of lack of knowledge."
Thank you, Doc.
So when we remove ignorance, especially as it pertains to prostate, if we replace the myths with the facts, it will help.
Yes, sir.
As he has already said, I'm born and I'm a urologist. The contact of our hospital, we are at Ugunkwo in Nsukka, and the hospital phone number is 081 400
It's all right,
Thank you
my people.
for having me.
Watch out and look out for the next episode. We love you. We love you. Live and live. Thank you,
Remain
Doc.
healthy. Thank you.
Freedom Square.